everyone, welcome back to my YouTube channel. In this video we will discuss about the difference in the skull. So differences are given below. Let's start with the wormian or sutural bones. There are small irregular bones found in the region of the frontalis and are formed by the additional ossification centers. They are most common at the lambda and the astrion, common at the pterion, epipteric bone, and the rare at the brachma. Women bones are common in the hydrocephalic skulls. Now we will talk about craniometry, the cephalic index. It expresses the shape of the head and the proportion of the breadth to length of the skull. Thus, the phenomena is cephalic index is equal to the breadth divided by length multiplied by 100. The length or the longest diameter is measured from the glabella to the occipital point. The breadth or the widest diameter is measured usually a little below the parietal tubula. Human races may be dolichocephalic or long-headed when the index is 75 or less. Mesatocephalic and dolichocephaly is a feature of primitive races like Eskimos, Negroes. Brachiocephaly through the Mesotrichocephaly has been a continuous change in the advanced races like the Europeans. Facial angle. This is the angle between two lines drawn from the nascent to Bayesian or anterior margin of the foramen magnum and a line drawn from the Bayesian to procyon or central point on the upper incisor alveolus. Facial angle is a rough index of the degree of the development of the brain because it is the angle between the facial skeleton, splenocrinium, and the clavaria, which are inversely proportional to each other. The angle is smallest in the most evolved race of the man. It is larger in the lower races and still larger in the anthropoids. Abnormal crania, oxalocephaly or archaeocephaly. Tower skull or stapler skull is an abnormally tall skull. It is due to the premature closure of the suture between the pre-sphenoid and post-sphenoid in the base. Coronal suture in the skull cap so that the skull is very short anteroposteriorly. Compensation is done by the upward growth of skull for engaging brain. Scapulopathy or broad-shaped skull is due to the premature synapses in the sagittal suture. As a result of the skull is very narrow from the side to side but greatly elongated. Now we will talk about the table 1.3 in which the feature male and female is clear. When we talk about the difference of the skull gender based, then we will talk about the weight. Weight of the skull is heavier in man than female. Female has a lighter skull and male have heavier. Size of the skull is larger in the males and smaller in the female. Capacity of the skull is greater in man and 10% less than manhood in females. In the females, the capacity of the skull is 10% less than man. When we talk about the walls are thicker in the males and thinner in the females. Muscular ridges, glabella, superficially arches, temporal lines, mastoid process, superior nuchal lines, and external occipital tuberance are more marked in the man and less marked in the female. Tympanic palate, larger and margins are more roughened in the male, smaller and margins are less roughened in the female. Supraorbital margins are more rounded in the man and sharp in the female. Forehead sloping receding in the male and vertical in the female. Frontal and parietal tubula less prominent in the male and more prominent in the female. Vault is rounded in the male and somewhat flattened in the female. Counter of the face. Longer due to the greater depth of the jaws, chin is bigger and project more forward. In general, the skull is more roughened due to the muscular marking and process, and zygomatic bones are more massive in the males, and in the case of the female, rounded facial bones are smoother and mandible and maxilla are smaller. If you have any query in this topic, you can ask me in the comment section. Thank you so much for liking and watching the video.